That joint is a door joint, and obviously it opens as a hinge to keep the door open and in one piece. The only problem is that's better. As you wear down the joint, you'll have squeakiness, you'll have the joint break down until it gets so much friction that it just breaks apart. I saw somebody in the urgent care center the other day for 2 months of pain from an AC joint sprain. That wasn't the diagnosis. The guy just came in and said he hurt his shoulder when he fell while playing soccer onto his side. And the doctors evaluated him. They said just take anti-inflammatories for a short amount of time, it should do fine. Those are obviously not wise words. Anything will do fine in the long run if it's a musculoskeletal injury, but the question is whether the fine amount of time is 2 weeks versus 2 years. The problem with a shoulder joint is that if it is kept in a very restricted position for a long amount of time, you'll get something called frozen shoulder or adhesive capsulitis. In my guy, the clavicle or collarbone is here, the acromion is here. Usually that joint sits like this, so you bring up your shoulder and it moves like a wishbone suspension. The problem when he landed on his shoulder is that this AC joint, it's called, the acromioclavicular joint, the AC joint, is held together by 2-3 ligaments. And sometimes when there's enough force put down, the ligaments will break. It won't come apart, but if you force trauma this way, it'll force the shoulder under and it'll snap it that way. So you can imagine if you have a few tight ligaments that hold this thing together and it moves up and down all the time, when you bring it underneath, it'll tear. Then when it tears, it'll come back out, but it'll usually hang up like this. You see a big tenting, it's called. Luke Longley from the Bulls had it when we were champions way back when. So if you research old pictures of Luke Longley, you'll see one of his shoulders with a big bump on it. It causes pain. It usually doesn't cause discomfort for too long of a time period, but again, when you have decreased range of motion from babying it or keeping it in a sling, especially at night, then it becomes tight and that becomes the predominant pain, frozen shoulder pain. And it's hard to tell between the AC sprain pain transitioning into frozen shoulder pain, and you wind up just having chronic discomfort, and then it leads to rotator cuff irritation, scapular dysfunction, and a couple other trigger points of the back. So it's worth being seen for by a gifted physical therapist. The problem with just going to any physical therapist is some of them don't have training in shoulder. Even with primary care, some doctors don't have training in shoulder or musculoskeletal. Even in surgery, some guys are good with knees, some guys are good with shoulders. So my suggestion is get in to see a physical therapist if you have insurance. Take an anti-inflammatory to take care of the inflammation here. I describe usually this kind of injury when the hockey player gets hit into the boards. When they hit the boards going at the velocity they're going at, the shoulder pad protects them from trauma from above, but the shoulder gets pushed in and you have that resultant pain, whether it's being hit and checked into the board or falling down on your shoulder or getting hit from above. Either way, the AC joint is the thing that's being affected, and with full separation, that's usually found by observation and x-rays. With full separation, you'll heal up, but we want to heal you up with as little pain as possible, little disability or frozen shoulder as possible, and then full participation in your usual activities. Range of motion, pitching, typing, overhead work, everything, even sleeping properly. So it is important, I think, not to just take an anti-inflammatory, take a pill and observe. I think it's important to get second opinions and active range of motion from a specialist who is trained in the shoulder. Otherwise you'll have what my patient has as far as 21-year-old with chronic pain in the shoulder now. So I wrote him a script for physical therapy. We'll hopefully get good results. I gave him an anti-inflammatory, but you can always rely on turmeric, glucosamine sulfate, magnesium, topical essential oils for pain relief, capsaicin, TENS units for electricity and decreasing inflammation, or even acupuncture. Whatever you choose, it is important that you get the inflammation covered quickly, the range of motion reestablished and returned back to normal, and then any form of dysfunction equalized so that both shoulders are about the same. And that's AC joint sprains.